I'd like to introduce Stewart Rose, who's the Vice President of Vegetarians of Washington.
Vegetarians of Washington has a problem that we're asking you to solve. Your patients, you may know about it, you may not know about it, come to us all the time. And for the past 15 years, your patients have been coming to us with their ills, their diabetes, their obesity, and in tremendous numbers, the coronary artery disease. And they ask for our help, but we're not doctors. So after a few years, we started actually getting in touch with some of their doctors with their permission, and the doctors said to us, they didn't teach us anything about this in medical school. So our Prescribe Vegetarian campaign is our effort as a nonprofit to change the situation so that practicing doctors are empowered with the information that they need and that the curriculum gets changed in the medical schools. And if those two things happen, we'll see a change out there. It'll be better for your patients, and we think it'll enhance your practice. So we'd like to go through some details and some specifics on that. We'll coin a term, Vegetarian Nutritional Medicine, using plant foods in the human diet to prevent and treat disease, because we think it has that potential, and we think the research bears that out, and we're big believers in evidence-based medicine in all the standard journals that I know that you consult and read. But those journals have been providing a tremendous amount of research recently. That research, to sum up, says that vegetarian nutritional medicine is both safe and efficacious for the prevention and treatment of many common diseases. And while we don't have time to address it tonight, some less common diseases as well. It hasn't been through FDA trials, no phase 1, phase 2, phase 3, and phase 4, but it's undergone an enormous human testing. Prescribing a healthy diet means that the medication you prescribe does not require a prescription. There's no insurance forms to fill out, no waiting in line at the pharmacy. And yet, for its potential to prevent and treat disease, it's something akin to a miracle drug, because it would help drastically reduce the rates of the most common diseases that I think you're facing in your practice. So our campaign is to teach doctors to use this powerful medicine, to change the medical school curricula to require the inclusion of vegetarian nutritional medicine in addition to the standard training that physicians receive. And we consider medications and surgery lifesavers and very important. This is an additional prophylaxis and therapeutic, and to empower practicing physicians to effectively learn to use it in their own practices. That's our goal. I know it's a tall order, but we don't shy away from a challenge at Vegetarians of Washington. For students, we believe that they should know the science, the basic nutritional science, and how different nutrients and foods functions in human beings. They should need to know the best practice, how to prescribe nutritional treatments as a monotherapy or as an adjunct. Maybe your patient will need a lower dose of diuretics or an ACE inhibitor. Okay, that itself would be very valuable. Effective delivery. The physician needs to know how to guide the patients through their dietary changes. Dietary changes don't often have an effect as fast as a medication, but given a couple of months, 2 or 3 months, you'll see some pretty significant effects. We're already seeing this, and even in diseases notoriously difficult to treat, the number of people who have come to us and turned to this to treat their diabetic peripheral neuropathy is not small. And they wonder why they never heard about it from their physician. Well, we'd like to change that. We'd like to change that. And here's what's driving it. Journal of the American Medical Association reports that diet is the #1 leading risk factor for disease and disability burden in the United States, yet doesn't have a large presence in the medical curriculum. What's wrong with this picture? Why couldn't we give it a larger presence? Well, some say, well, you know, the medical education is already so jam-packed. I understand, but this is the #1 leading risk factor for disease and disability in the United States. It should have a little bit more. Yes, you have to learn anatomy. Yes, you have to take biochemistry. Yes, you have to take cardiology and endocrinology. And yes, you have to take pathology. And those are all important. And we wouldn't dream of dispensing with any of those. But there needs to be information, because this is what's facing the American population. This is what your patients are dealing with. Yet 90% of doctors, according to a report, feel that their training in nutrition was inadequate. The doctors are frustrated themselves. Clearly, this is a situation that isn't working for anybody. Dr. Caldwell Elsenstein says that, you know, that he's upset that there's not enough interest. I mean, we'll put in this category, we'll call it lifestyle medicine, tobacco use, drug use, but also diet. And food is a very important determinant of the health of your patients. Patients are waiting for their doctors to learn this, but they're impatient. Your patients are impatient. And what they do, and we wish they wouldn't do this, they turn to the internet, Dr. Google, or Dr. Wikipedia. And we were very concerned to see that a medical university study showed that over 90% of the health information articles in Wikipedia contained errors. And besides, that's not the right way to practice medicine. Your patients shouldn't be roaming through the internet. They want their physicians to know what's best for them. And Vegetarians in Washington wants the same thing. In fact, some of what we find on the internet is nothing less than shocking. Anybody can put up a website. Evidence-based medicine is the way to go with all of this, and we feel very strongly about it. Some people say, well, this is kind of radical of you guys. Really? A vegetarian diet. It certainly would be a change. Cardiologist Gene Ornish makes the following statement. I don't understand why asking people to eat a well-balanced diet is considered drastic, while it is medically conservative to cut people open and put them on cholesterol-lowering drugs for the rest of their lives. A healthy diet is not radical. It should be based on evidence. It should be well integrated with the rest of your treatment, their medications, considering for surgery. It can be blended in. Some doctors feel, you know, this is all very well and nice, and there's evidence, but my patients will never go for it. You must be kidding. Studies show that even in communities that have a very high level of meat consumption and traditional, such as this study that was done in Appalachia, showed that once their doctor prescribes this and explains its rationale, your patients will go for it. Maybe not all of them, but I don't know what has 100% patient compliance out there. And so evidence shows that your patients will go for it. Offer it to them. If they don't accept it, well, you know, the standard modalities are always available. Going on with patient compliance, they did one study in heart patients with coronary artery disease, and they were able to document 89% compliance on a plant-based diet over a length of 4 years. So my patients will comply with it, but they won't stick with it. They'll be good for a couple of months, and then it'll be the same old story. But we think differently. We think differently, and we interact with your patients all the time. Why hasn't this been tried before? This is a really important question. And again, we are big on understanding and accepting and even promoting appropriate use of medication and surgery. They are lifesavers. And I wouldn't want to live in a medical world without them. But it could lead to a kind of tunnel vision. So when one looks at the videos from the different conferences for the different specialties, it's how to refine a surgical technique, different ways medications can be combined and used together. And there's almost nothing on lifestyle. Maybe there'll be passing mention. And I wonder if in the development of medicine, no one's going to get a patent for lentils in oatmeal. And I understand that. But I wonder if it isn't leading to a certain tunnel vision where we don't start to look at simple things, low-tech solutions, to add into the high-tech solutions. And so we're concerned of a bit of tunnel vision out there. And some people say, well, we need more research. And they delay and delay and delay. Actually, modern medicine has moved on far less research than we have, and far quicker than they're doing when it comes to the health benefits of a plant-based diet. The president of the American College of Lifestyle Medicine, Dr. Katz, says, we know enough, we do too little. Vegetarian nutritional medicine will be an additional tool in the physician's toolbox. No side effects, no contraindications. It's got a lot to recommend it, and it marvelously obeys the first rule of medicine, which is to do no harm. You know that it's safe for your patients. And however much benefit they get, is so much the better for them. And your patients are counting on you. They are. This is from Dr. Tuso at Kaiser Permanente. The future of healthcare will involve an evolution towards a paradigm where the prevention and treatment of disease is centered not on a pill or a surgical procedure, but on another serving of fruits and vegetables. We have launched the vegetarianprescription.org. On it, you will find detailed, evidence-based articles, very carefully selected references, ones that we feel good about, the sample size, the statistical treatment, in mainstream medical journals, and you'll find research summaries on these topics, and not just on the common diseases. How about reducing the risk of cataracts, biliary disease? We could all use, the American population could use for a reduction in the risk of gallstones. The application is far wide. Does it apply to everything? No. If your patients have pes planus or flat feet, I think they're going to need standard podiatric treatment. But for many other things, this tool could be used in appropriately chosen patients. Thank you all for being here. Thanks to the physicians. Thank you all very much.